When Signalise took over the contract for our local cancer hospital, which is Clatterbridge, our experience of accessing healthcare was completely different. As I mentioned earlier, Signalise is built from the ground up by the deaf community for the deaf community, which means it's fully accessible. You can contact them through a range of methods. You can have your own account, which means you can select which interpreters you would like to use, and you are provided with a regular interpreter of a really high quality, which is really important when you're being diagnosed or treated for serious health conditions. When we use other language agencies, our experience of them has been completely different. You never knew when you were going to get an interpreter. You never knew who that interpreter would be and what their skill level or capability would be like. Signalise, when you logged into your account, you could see who had been booked. So you weren't nervous or apprehensive attending appointments because you knew an interpreter would be there. Other language agencies don't give you any of this information, so you turn up to the appointment not knowing who would be there, but more often than not, no one would be there. It meant that when Signalise took over the contract, I remember at the time I was really proactive in sending all the appointment letters and appointment times, making sure they knew about them all. And in reality, it was because I was used to fighting those battles to get Dad's rights. Signalise was completely different. Their staff are proactive, which means that they will chase up the hospital. They will educate the department on how to book interpreters and make sure follow-up appointments are booked. They will preempt when an interpreter is needed. And I really praise them and I'm really grateful for that. Our experience of other language agencies is that they won't provide interpreters, and they asked me to teach healthcare staff how to do it. So our experiences were completely different. It meant that when I was there at an appointment with my father, I could become his daughter again. And I've said many a times, it felt like I could breathe again. I was like a zombie throughout the whole experience. I was frozen, but it was better. It was so much better. And I knew from my dad's experience, he felt it was so much better. I think probably sometimes he wanted to ask questions, but he didn't want to use me to ask those questions. And they would be important and sad questions, like how long have I got left? You don't want to ask that question through a family member. Also, I felt like he was happier because he had more autonomy over his healthcare. The quality of interpreting by Signalise was completely different. It was a much higher standard, which meant that the interpreter was relaying all the information in a way he could understand. They were also culturally mediating. They knew when to be sensitive. They would read a room. And as I've explained in a different clip, when Dad was in a hospice, the interpreter was so good. He would relay to the doctor not only what Dad was signing, but what he was seeing. He would tell the doctor, his signing's not clear, I've noticed a deterioration since yesterday. And that was really important. And that shows the difference that a high level of interpreting can offer. My experience of Signalise, I'm sorry, I'm getting emotional here, but I'm really grateful to them because Dad and I could become father and daughter again. And we didn't have that before when we were using spoken language agencies or through the hospital, and those hospitals who still now contract to spoken language agencies. I'll forever be grateful to Signalise, and I hope the commissioners see that and understand what their decision making and cost saving has and the effect it has on deaf people and deaf families' lives. Thanks for watching.